Welcome to the Deep Dive. Today we're uncovering, well, a surprisingly powerful tool for dealing with type 2 diabetes.
Something that maybe doesn't always get the spotlight it deserves.
Exactly. Resistance training, we're talking lifting weights, using bands, even just your body weight.
Yeah.
And this deep dive is kind of your shortcut to understanding why it's such a key ally for your health.
Right. People might know about diet, maybe cardio, but the research on resistance training is really compelling. We're looking at a mix of sources today, aren't we?
Yeah, we've got a foundational review from back in 2013.
Biomed Research International, that one, really set the stage.
And then we're layering on top of that the newer stuff, findings in the last 10 years or so.
So kind of the established knowledge plus the latest updates.
That's the plan. Our mission here is to pull out the really crucial bits. How resistance training helps prevent and manage type 2 diabetes. We'll skip the super technical jargon.
Focus on what actually matters, what people can, potentially use.
Okay, let's dive in. That 2013 review, what were the fundamental ways it showed resistance training helps?
Well, the most obvious starting point is muscle mass. Resistance training builds muscle.
Right, it makes sense.
And the key insight there is more muscle essentially means more storage space for glucose. Better blood sugar control follows from that.
Ah, okay. So muscles act like sponges for sugar.
That's a great way to put it, yeah. They soak up glucose from your blood. And resistance training makes those sponges, bigger and just more efficient.
How does it make them more efficient?
It boosts your body's sensitivity to insulin. A big part of that is moving these things called GLUT4 transporters to the surface of the muscle cells.
GLUT4. All right.
Think of them like a tiny doors opening up on the muscle cell surface, letting the glucose in. Resistance training helps open more doors more effectively.
Right. So it's not just bigger muscles on the outside. It's actually changing how the body handles sugar, like deep inside. Does it go even deeper? Cellular level stuff?
Absolutely. The review really highlighted the activation of specific pathways inside the cells, pathways that respond to insulin.
Okay, pathways. Are these complicated?
The names can sound a bit much. PI3K-AKT-mTOR is one key pathway mentioned, but honestly, the takeaway is simpler.
Good. What's the takeaway?
Resistance exercise basically flips a switch on these pathways, and that leads to better glucose uptake, and it helps build and repair muscle tissue. So yes, right down at the cellular level, things are improving.
Got it. So we're building bigger sugar sponges, and we're making the doorways for the sugar to get into those sponges work better. That clicks. Now, the review also mentioned inflammation. How does that fit in?
That's super important. We know now that chronic, sort of low-grade inflammation is really bad news for insulin sensitivity. It makes cells resistant.
Yeah, you hear about inflammation being linked to lots of chronic issues.
Exactly. And the 2013 review pointed out that regular resistance training actually has an anti-inflammatory effect. It helps manage these signaling molecules, cytokines.
Like IL-6 and TNF-alpha. I think I've seen those mentioned.
Those are the ones. Think of them as alarm signals for inflammation. Resistance training helps kind of quiet down those signals. Less inflammation means insulin can work better.
Okay, so that foundational work established it's not just about strength. It's really tweaking our metabolism, handling glucose better, calming inflammation. Now, let's jump forward. The last decade, what new things have we learned? This is where it gets really practical, maybe.
Definitely. One of the most valuable updates is getting much more specific about how to train for these benefits, like what actually works best.
Okay, give us the specifics. What does the recent research suggest?
Well, there's pretty good consistency now. Training about 2 to 3 times per week seems to be the sweet spot.
Frequency, got it. What about, how hard?
Intensity matters. Aiming for something that feels like a 7 or 8 out of 10 in difficulty, technically that's around 70 to 80% of your 1 rep max.
Your 1 rep max being the absolute heaviest you could possibly lift just one time.
Exactly. You don't need to test that necessarily, but aim for that challenging zone. Then in terms of structure,
Sets and reps.
around 3 sets of 8 to 10 repetitions seems effective. And importantly, keeping the rest periods between sets relatively short, ideally under 60 seconds.
Okay, 2-3 times a week, 70-80% intensity, 3 sets of 8-10 reps, short rests. Why those specifics?
Because studies linking those kinds of parameters show clear improvements in things like HbA1c.
Your average blood sugar over months.
Right, and fasting blood glucose and insulin sensitivity markers. So it's targeted training that delivers measurable results for metabolic health.
That's super helpful. Concrete advice. And you mentioned metabolic health. Does it go beyond just blood sugar numbers?
Oh, absolutely. That's another key update from the last decade. The focus has broadened. We see improvements in lipid profiles,
Game.
lower triglycerides, those are fats in the blood you don't want too much of, and higher HDL cholesterol, the good cholesterol.
Okay, better cholesterol profile. What else?
Changes in body composition, too. Reductions in overall body fat, and particularly waist circumference. Those are big risk factors for diabetes and heart disease.
So it's a much more holistic benefit than just glucose control. It's hitting multiple markers for metabolic health.
Exactly. It's a whole body win.
What about prevention? Can resistance training actually stop someone from getting type 2 diabetes?
This is a really exciting area of recent research. The potential for prevention looks strong, especially for people already at higher risk.
Like people with prediabetes, maybe?
Or family history.
Precisely. Studies are showing improvements in fasting insulin levels and also in scores like HOMA-IR, which measures insulin resistance.
So catching it early, or even before it starts.
Yeah, suggesting that adding resistance training could be a really powerful preventative strategy, helping to keep insulin resistance at bay.
That's really encouraging news. Now, a practical point often comes up. Doesn't matter where you do it. Supervised at a gym versus, say, following a YouTube video at home.
Ah, yes, the supervised versus home-based question. The research does suggest a difference there.
What kind of difference? Well, generally speaking, supervised training tends to yield more robust results, especially in terms of gaining muscle mass and seeing significant shifts in glycemic control.
Why is that, do you think? Better form, motivation, pushing harder.
Probably a mix of all those. Having guidance on proper form, ensuring you're progressing the intensity, lifting heavier over time, that structure seems key. Home workouts are still beneficial, don't get me wrong. Any activity is good.
But maybe the gains aren't quite as pronounced without that structure and intensity push.
That seems to be the trend in the research, yes. Especially if the home routine isn't progressively challenging enough, it really underlines the value of getting it right, especially if you have specific health goals like managing diabetes.
Makes total sense. Having that expert eye can make a real difference.
Okay, and one last update area, back down to the tiny stuff, the molecular level. Anything new there?
Yes, the picture keeps getting sharper. Recent studies confirm the earlier findings about those cellular pathways, but add more detail.
Like understanding how resistance training can influence the actual type of muscle fibers you have, it seems to encourage a shift towards fibers that are more, let's say, oxidative and more sensitive to insulin.
So better quality muscle, not just more muscle.
In a way, yes. And there's also a growing appreciation for something called mitochondrial biogenesis.
Mitochondria, the powerhouses of the cell, right?
Exactly. Resistance training stimulates the creation of new, healthy mitochondria within muscle cells. More powerhouses mean better energy processing, better metabolic function overall, including how glucose is handled.
Wow. So it's this cascade, isn't it?
Yeah.
From molecules and fibers right up to overall body fat and blood sugar. It really drives home that this isn't just working out.
It's deeply physiological. It's changing how your body works at fundamental levels.
Which leads us to the big idea, resistance training as medicine. Is that how we should be thinking about it?
Based on the evidence we've discussed, from 2013 through to now, I'd say absolutely. It's a potent therapeutic tool and a preventative one, too.
For type 2 diabetes specifically.
Yes. Its effects on glucose metabolism, inflammation, body composition, they're profound and directly relevant to diabetes.
And the key seems to be doing it right. Following those guidelines on frequency, intensity, maybe getting some help if you're starting out or have health concerns.
Exactly. Implementation matters. It's not just doing resistance training, it's doing it effectively and safely. But when you do, yeah, it's powerful stuff. It really can be considered frontline medicine in this context.
Okay, let's wrap this deep dive up. Key takeaways for everyone listening. First, resistance training builds muscle, making your body better at taking up glucose, partly by improving insulin sensitivity.
Right, those GLUT4 doors opening up.
Second, it helps fight that chronic inflammation linked to insulin resistance.
Well, calming down those cytokine signals.
Third, we now have pretty specific advice. 2-3 times a week, challenging intensity, like 3 sets of 8-10 reps, short rests.
Those parameters seem consistently linked to metabolic benefits.
Fourth, the benefits aren't just blood sugar. Better cholesterol, less body fat, especially around the waist. It's a whole body tune-up.
Definitely broader metabolic improvements.
Fifth, huge potential for prevention, especially in high-risk folks. It can improve insulin resistance markers before diabetes fully develops.
A proactive strategy for sure.
And finally, supervised training might offer an edge over unstructured home workouts for maximizing those gains, and it's all driven by changes deep inside our muscles, down to the fibers and mitochondria.
It's fascinating how these mechanical stresses translate into such widespread metabolic benefits.
It really is. Which leads to, I guess, a final thought for you, the listener. Given all this, given these pretty profound effects, what's one step, maybe small, maybe bigger, that you could think about to bring some resistance training into your life?
Regardless of where you're starting from today.
Yeah. Think beyond just exercise. Think of it as this incredibly effective strategy for your long-term metabolic health, a proactive investment.
Shifting that perspective, maybe seeing movement, especially strength work, through this metabolic lens.
Well, thanks for diving deep with us today. We really hope this gives you a clearer, maybe more compelling picture of just how powerful resistance training can be.